and place the ministry and the department at the center of building a capable, ethical, and developmental state. And this requires us to modernize government, focusing on, among others, innovation and efficiency. The enactment of the Public Service Act 1994 ushered in a new era in the South African public service, premised on transformation and a new democratic dispensation. In seeking to entrench the constitutional values and principles outlined above, the public service adopted the Batuphile principles with the vision of a better life for all South Africans by putting people first. And we need to remind all our public servants all over where they are that each one of them out there have a personal duty over and above that imposed by the department on behalf of our government to ensure we uphold all these principles of Batuphile, summarized as putting people first all the time. Academics and politicians globally have debated the role of the state over time, including at times of upheavals and instability. The role of the state has shifted to the spotlight depending on how effective it discharges its current responsibilities under the current circumstances we find ourselves in. The state may re-evolve. When COVID-19 outbreak attacked humanity across the globe, the question arose, what should the role of the state be? And the second question has always been, how will the state respond to this crisis? Now, these two questions, as I say above, have put the whole question of the role of state on a spotlight. In our case, the state sought to protect the citizens against primarily the infection of COVID-19 and the harsh effects on the people, whilst also supporting the economy during a time when restricted movement was necessary. Our state, represented by our government, has provided decisive leadership in our fight against COVID-19 and at all times cognizant of our constitutional obligations, and government has ensured, number one, accountability and ethics. Government has had to take various decisions to support its citizens, but that had to be done in an accountable manner through consultations with stakeholders in the public sector, in the private sector, in the academia, business, and society general, and all measures requiring the highest ethical standards. We have had to collaborate with experts, and we have seen the benefits of the state acknowledging, recognizing, and ensuring that we are guided in most of our activities, particularly on COVID-19, guided by expertise that comes from those who are experts in the health sector, but also in the public on related services. So government has had to perform its obligations in a manner that is evidence-based or evidence-driven, taking into account contributions from these experts. And I think all of us in the country see the benefits. And we in public administration want to value these contributions by our experts in delivering this particular service and other services that we have a responsibility to deliver to the people of South Africa. The value of expertise. On greater policy certainty, we based our approach on a broader policy of providing health care to all and providing financial support to all citizens based on need and affordability of the state. We also endeavored to be prompt and to be very decisive in our decision making in relation to lockdown, which is now known throughout the world that the South African government, led by President Cyril Ramaphosa, took prompt decisions on this matter to delay the spread of coronavirus by taking a prompt decision or an early decision to lock down. And there were other various decisions that were taken thereafter in relation to funding and criteria thereof of business and individuals who needed assistance in this particular period. There were prompt issuing of disaster management regulations, which were aimed at curbing the spread of COVID-19, and also other regulations in relation to the economy and supporting those who were in need in that particular sector. And this goes on to include employees that were in need of support after businesses got affected by lockdown. We also endeavored to be very efficient in implementing whatever decision would have been taken by Cabinet in relation to COVID-19, and we have sought to enhance the value, and we recognize it, of efficiency, which we still have to make an effort on as a country, particularly in public service. Efficient implementation of all decisions taken. But finally, we see the value, and we've always endeavored to make sure that we build capacity of public servants, which were hard at work and are doing it at the moment. Public servants have been, during this COVID-19 fight, capacitated through a plethora of guidelines, especially those on the front lines, and of course skills relating to COVID-19. And the issue of PPEs remain a concern in some areas and is receiving the attention of the Department of Health to ensure the safety of frontline health workers and to facilitate this on this matter, to facilitate accurate response depending on the circumstances where these PPEs are needed and what kind of PPEs are needed, in which circumstances, stakeholders in specific facilities, especially health facilities, are encouraged to ensure alertness of the Department of Health on their needs. So let's engage out there. Let's raise our hands out there. Let's speak out there on these needs, because it is difficult, as it has been proven, to ascertain at all times what is needed where, because of different circumstances where frontline health workers are working and are called upon to deliver this health service. Public servants have been rendering exceptional services to South Africans in various fields such as health, defense, immigration, safety, among others. Our state has progressed from serving a few to serving all citizens in this country, especially since 1994. This is usually evidenced during the month of September each year when we honor public servants by celebrating Public Servants Month. However, our true test as the public service will be how we support the citizens of our country during this period of turmoil, where dependence on the state for services will be especially higher. We take this opportunity to honor all our public servants in the country, especially those who are not working from home but are occupying the front lines and offering support to the people. Well, we also take this opportunity to honor the heroes and heroines who, in the course of their duties, pass on. And we say to those, may God bless their souls, and our sympathies to all their families. The COVID-19 invaded South Africa at a time when government was hard at work to revive the declining economy. We were busy fighting poverty and hunger and improving the conditions of our people. In the past, we've endured the number of challenges, including TB and HIV and AIDS. But so far, the COVID-19 seems to be more daunting, especially since there are so many unknowns about this disease. The current positions we find ourselves in will test the capability of the state more than before and to the maximum. We are hard at work doing an overall interrogation of the current capabilities of our state in a number of areas to assess, adjust and adapt our operations for the future to deliver optimally in regard to services during any pandemic, including this one. At this stage, it becomes relevant to borrow from Abraham Lincoln, and I quote, "The dogmas of the quiet past are inadequate to the stormy present. The occasion is piled with high difficulty, and we must rise with the occasion. As our case is new, so we must think anew and act anew." Close quotes. As we move through the various alert levels, we need to plan for the normalization of the public service. On the 23rd of April 2020, President Cyril Ramaphosa announced a risk-adjusted approach to slowly unlock the economic activities in some sections in phases, easing some of the restrictions effected during national lockdown placed on the 26th of March 2020, in response to measures needed to contain the spread of COVID-19 pandemic in the country. The phased strategy consists of 5 levels, detailing how activities will be opened up to bring back some normality, whilst taking cognizance of the presence of the virus, with level 5 referred to as the lockdown phase. The country is now at level 4, and level 4 allows for the easing of some of the restrictions put in place during the national lockdown, thereby gradually unlocking certain economic activities to resume without compromising progress made in the containment of COVID-19. During this transition between the levels, the focus of public service is continuously to ensure the provision of services required for the effective functioning of government and to ensure necessary support for all sectors that will become incrementally active during the various levels. For government to facilitate the unlocking of the economy, there will be a need for more public servants to return to the workplace to provide services that will be required by those sectors that are part of the level 4 phase, over and above other basic services that were part of the critical and essential services during lockdown period, and level 5. The Department of Public Service and Administration has issued many circulars, the latest being Circular 18 of 2020, to the entire public service that details necessary measures which national and provincial departments ought to implement to ensure the containment and management of COVID-19 in the public service. In developing the circulars, we took into consideration various relevant laws such as Basic Conditions of Employment Act, the Disaster Management Act, Labor Relations Act, Occupational Health Safety Act, Public Service Regulations 2016. The department will be working over and above this. The department will be working on a framework that articulates details and norms and standards that should apply to many public servants that would be working from home. So we need this particular kind of framework that will detail and guide the behavior and the standards and norms that should apply as public servants work from home. We will be embarking on that one. These circulars provide guidance on occupational health and safety measures required within a workplace to contain the spread of the virus as and when public servants come back and normalize public service. Amongst the provisions in this circular require departments to set up internal COVID-19 steering committees, to put in place implementation plans at the different levels of alertness, to demonstrate how departments will ensure service delivery with sufficient capacity for government services to return to normality, while ensuring necessary precautionary health and safety measures. As a directive, departments are reminded that all employment conditions and agreements are to be observed with necessary flexibilities of working from home. Care should be given on all pertinent issues, including leave arrangements for employees and reporting mechanisms in relation to gaps caused by lack of laptops for each employee. What we're referring to here is that other employees, especially those that are working from home, don't have laptops in relation to the work that they need to do, and in relation in particular to leave arrangements and other work-related activities. And so heads of departments need to make sure that they close all these particular gaps while ensuring that work continues. COVID-19 committees must continuously monitor the implementation of their department strategies, risk assessments, workplace procedures, and systems to counter the spread of COVID-19 and provide response reports to the National Steering Committee. And at this particular moment, I just want to take a pause and report that we have written to the chair of the Public Service Commission in relation to the statement that was made the other day to the Portfolio Committee that the Public Service Commission doesn't appear on the regulations as a department rendering essential service. And want to clarify that the Commission is in a category of departments that are required to ensure, among other things, that government business continues. And that's why, among other things, they were at the Portfolio Committee on that day. And we've clarified the matter with the chair of the Public Service Commission to enable them to resume their work and especially in determining on their own what is essential in their circumstances and embark on those as it were. All Directors General and HODs are directed to ensure that all health and precautionary measures to prevent and contain the spread of COVID-19 are adhered to in their respective departments by implementing systems that will manage issues of hygiene and social distancing upon return of employees to the workplace. Given that during the lockdown period, government operations were required to continue, And departments had already identified the critical services that required employees to be physically present at workplace, while others were adapted to online services or remote working. It is advised that with increasing demands of the easing of the lockdown, departments may need to identify more employees responsible for such critical services and recall them back to office if necessary, supplement capacity. In line with the recent circular issued for all DGs and HODs, departments must develop a schedule for a staggered return of the workforce, which will assist in managing the number of employees at the workplace at the same time to maintain service and business continuity. The schedule must be disseminated to all employees and to be relevant sectors in support of the restart of the economy and other related activities. DGs and HODs must ensure that employees who are required to be at the workplace be issued with requisite permit authorizing travel for workplace purposes. To limit the number of employees arriving, living, or working at the same time, the DGs and HODs should consider amending working times to minimize the risk associated with simultaneous arrival and departure of employees. To reduce the number of employees at the same time in common areas such as kitchens and canteens, the staggering of employees' meal intervals and other related activities should be considered. On remote work arrangements, as indicated above, social distancing is an important consideration. As such, remote work has become an important mechanism in the fight against the spread of these COVID-19 diseases. And that's why we've made a reference to the need for us to develop a detailed framework of norms and standards so that people are conscious all the time that as they work from home, there are certain expectations in terms of their work or the work that they need to do while at home as a result of the outbreak of the disease. Where employees can work remotely from their homes, departments are encouraged to continue with this approach, taking into consideration the requirements as outlined in Circular 15 of 2020 with regard to critical and essential services. Further, the departments are asked to strengthen such capabilities by ensuring that employees have necessary resources for remote work and productively utilized. It must be clarified that although employees may be working remotely, they may also be required from time to time to attend the workplace as may be necessary, to, among other things, receive instructions, documentation, access office infrastructure like desktops and other things, and to submit completed tasks where relevant. DGs and HODs must make a determination on employees' readiness to work remotely, of course bearing in mind the higher risk for COVID-19 that COVID-19 poses to older employees and those that present with comorbidities. Those employees will be expected to submit evidential documentation to their human resources so that there's common understanding of how such conditions need to be managed. It will be necessary to go to detail on those with their relevant supervisors. The decision on remote working must be made with due consideration to the service delivery needs of the departments. On workplace preparation in response to the easing of the lockdown incrementally, as departments prepare for the opening and return of employees, which is not now, a thorough cleaning of the workplace will have to be undertaken to ensure it is clean, hygienic, and that all guidelines outlined in Circular 7 of 2020 as they pertain to the preparation for the containment and management of COVID-19 in the public service are observed. These will include temperature screening for each employee entering the building and mandatory wearing of cloth masks at all times in the workplace by non-medical personnel, placing of hand sanitizer strategically at all entrances, common areas, doorways, lifts or elevators, escalators, handrails where office equipment is shared, etc. Visits to the workplace by non-employees must be by prior arrangement and only where absolutely necessary. These exclude service recipients at service delivery points. The detail of such visitors must be recorded for track and trace purposes all the time. All employees whose operational requirements require personal protective equipment should at all times be provided with such. In assisting employees who need support in relation to the impact of COVID-19, departments should ensure that the requisite employee assistance programs are available to offer such support. As we conclude, government further urge citizens to utilize online services where available so as to lessen physical interaction and minimize the risk associated with the transmission of COVID-19, while trying to bring in necessary services back into operation. COVID-19 remains a threat to everyone, and therefore extra care should always be exercised by public servants who are performing their duties during this challenging period. And we urge all public servants to be ambassadors of government in relation to alertness of the danger that all of us are facing. Public servants should shed light to all citizens and honestly do so against all wrong assumptions that are out there that we are often coming across where people tend to make, in certain circumstances and areas, wrong assumptions about the disease. So we expect our public servants, among other things, to ensure that they spread the correct alertness of the public on this matter. It is worrying to note that to date, there are 511 health workers that have been infected with the virus, including a doctor and a nurse who have lost their lives, among others. At this juncture, we would also like to express our gratitude to essential and frontline public servants for their sterling work and the challenges we are going through as a country. Their dedication and commitment give us hope that we will turn the corner in the light against COVID-19 and should serve as a reminder to public servants that we belong to our communities. We care, and then we serve. This is our motto as a as the Department of Public Service and Administration. Thank you very much.
Thank you very much, Minister. We are now going to be taking questions from journalists. As you know, we are observing social distancing. Some of the journalists will be calling in and some will be communicating via SMS. Let's start. Do we have any questions? Please introduce yourself and the media house that you are representing.
We don't have any question at the moment on the line.
All right. Good morning. This is Barry Bateman from ENCA. Minister, we're now into week 6 of the lockdown, okay? But you're talking here about government, public servants are now we are embarking on the process to develop the framework and standards to allow for the public servants to return to work, okay, once a little. The private sector has put in place all the measures to be able to kickstart this economy and get going weeks ago, right? Jobs are being lost by the thousands, and the private sector is saying we need to go now. But here you talk about efficiency in the public service, but only now are you looking at putting in place the mechanisms to try and return to work. How can anybody take it seriously that you talk about efficiency when you haven't even yet looked at the mechanisms to get the public service back going again? Thank you.
Thank you, Perry. Do we have another question?
Minister, we have a caller. We have Kaupa Lily from the Foreign
Okay, go ahead.
Hello, Minister. I just wanted to find out which public servants are expected to go to work, which departments are likely to be the first to go back to work now during level 4. And how do you determine who goes back to work? Because there are parents who are public servants who are complaining that their kids aren't at school and they can't leave their kids at school. How will that determination be done? Thank you.
Thank you. Do you have another question?
We don't have anyone yet.
Okay. I think, Minister, you can respond. Oh, do you have SMSs?
No, thanks, Vokal. So far, we don't have any question on WhatsApp. Thanks.
Okay. Thanks, Minister. You may come.
Thank you very much. In response to ENCA, I want to say the following. It is this press briefing that is happening now. The work that we are outlining, it talks both to what we have already done, as far back as when lockdown was announced. We immediately set about doing our work. You would recall, as I've stated in my statement, that government took a decision that certain essential services will have to be rendered even during stage 5 of the alertness. And even during that time, at the declaration of the state of disaster, in fact, I must state to you that there are public servants who never went home whatsoever, who never took leave, who never even have had any weekend whatsoever. They've always been at work. And therefore that we're holding a press briefing today does not mean, and talking like this, doesn't mean that work is only starting now. We're merely adding on what we've always been doing and letting the public know what we've been doing and how we've been doing it, but also indicating how we plan to go forward. So our plans that we're talking about now, like this circular 18 was issued almost a week ago, on top of other circulars that have been issued from time to time in keeping with the developments in terms of stage 4 and reopening of other related activities. And I hope I'm making myself very clear on that matter. And I want to again take this opportunity and thank once more those public servants that have been rendering these services all the time. You are aware, among others, that police, army, hospital workers or health workers, they have always been there. And those who are on the rear basis in terms of a line of service, who have been working inside offices, servicing those who are in the front line, they are all included in our appreciation. The second question is this one on how do we determine, or how are we going to determine who must go back to work? We have clearly stated, as we have done in different circulars, that first we decided what would we issued a circular that directed directors general and HODs as to determine, to work out who in their setup as a department, or what in their setups at different departments at different levels constituted essential service. Once departments knew what constituted essential service in their setup, they then went on to then identify employees who would man those essential services as determined, and those were then required to be at work. And as we continue to do so, workers identified and associated with essential services, or those services that are gradually being opened up, then those workers will be identified as such by their supervisors under the leadership of their HODs and DGs, and there will be consistent consultations with all the sectors at work. We issued a direction via the department that all heads of departments and all DGs needed to have substantive consultations with labor in their departments, just to make sure that we broaden understanding, we broaden involvement, and we broaden cooperation, which we are encouraging even now, that all those processes will be worked out together with all the stakeholders on the ground. And this is necessary, especially in the light of what I spoke to earlier on in relation to other circulars, including Circular 7, to make sure that we are sensitive all the time to the needs of individual employees, but while at the same time ensuring continuity in terms of government business. Thank you.
Thank you, Minister. I don't know whether we still have questions from journalists.
Yes, we have one caller.
Okay.
Please go to your
Okay, my name is Kagiso Mako from the National Union of Public Service and Allied Workers. I've got 3 questions for the Minister. Firstly, I would like to know, is there any provision for danger allowance for the workers once they go back to work? Number 2 is the government has entered into a 3-year agreement with the workers regarding the wage bill, and so far I hear that the Minister has not touched any basis. And when can we expect the implementation of the last leg of the wage bill for public servants? And my other question is, when is the department going to work with health workers of the public servants? What is the department's plan to pay them accordingly? Thank you.
We did not get the third question. Can you repeat it, please? Oh, she's gone. Okay, can you take another one?
We don't have any caller.
Okay, you don't have any caller. Any SMSs, Takalani?
No, we don't have so far, thanks.
Okay, Minister?
Vugani, you may have you may be clear on what the question was referring to. What allowance was this? Danger allowance. Okay. Now let me say this in relation to that. We say the current situation occasioned by the crisis out there should be understood to be in line with the Public Service Act. and applicable agreements, applicable regulations and all. So where danger allowance in terms of the Public Service Act and in terms of any relevant agreement obtained, so it will be like that. Where various departments, particularly Department of Health, feels that there is a particular need as a result of any circumstances, such will be considered by the relevant department based on relevant agreements and the Public Service Act. Number two, if I heard the caller clearly, is making reference to the wage bill. And in relation to that, I want to say that this particular issue, sensitive as it is now under a dispute. In other words, we're at a situation where organized labor has declared a dispute, and as such, this matter is sub judice, meaning it is at a stage where we are not at liberty to give details in terms of what is happening beyond saying the matter is sub judice as a result of a declaration of the dispute. I didn't quite get the last question. It was about?
It's about provision of data, Minister, for employees who are working remotely.
Yes, provision of data. You would have we would have come across clearly to you, caller, when we said HODs and DGs need to work on detailed provide in terms of norms and standards that provides for this particular period. And those details, among others, as I said, pertain to leave arrangements, pertain to workers who don't have laptops but have desktops at work. And this will include exactly the provision of data. And somewhere there is even provision that where expenses are incurred by employees while they are at home in relation to work that they need to do, such will have to be reimbursed or provided for by individual departments as per arrangements that are being made. What we are making a call for here in relation to your question is that each HOD, each department is directed to make such arrangements. And where they have not been made, they must be made with immediate effect, because it is necessary that we carry on with government business without any disturbance whatsoever. Thank you.
Okay, thank you, Minister. We'll take the last round of questions because the Minister unfortunately has another commitment. Okay, go ahead, Perry.
Thank you. It's Barry Bateman from ENCA again. Minister, are you able to just give me a breakdown of the figures in terms of reporting for service at the moment? You spoke about it was determined quite early on the number of essential workers. So we have our police and health workers and so on. Understand? Are you able to say what percentage of the public servant workforce are at work or have been at work under lockdown 5? What that percentage may be increased in 4, and what you anticipate it to be in 3, 2, and 1, for example. So we get an idea of the gradual steps that public servants will be actually returning to their work, whether it be at home or wherever, just so I have an understanding.
Okay, Minister, we'll take another question.
Minister, we have one call from Kagiso again to repeat the last question. Okay, so you can go through.
Yes. I have questions. One of the question is when is the department going to recognize community health workers of the public servants, and what is the department's plan to pay them? Then my last question is, does the minister think that the department have had enough time to check areas of employment to make sure that they are in good condition to the plans of regarding safety, especially for the workers once they get back?
Okay, thank you. Do we have another question? SMSs?
Thanks, Vukani. Yes, so we do have a question. The first question is from Labengwa Rusani from Vibrant Voices SA. And the question is related to the pending interviews and recruitment processes which were underway just before the lockdown. And the question is whether such processes will be reversed or will continue as and when the levels gets lowered. And the two questions that I have, the two following questions are the public servants. I'm not sure whether I should go on with the questions from the public servants.
Okay.
And the first question is an employee from the Department of Human Settlement and is working at the finance section. It's said management is expecting us to start with rotation from Monday the 11th. Kindly indicate the date in which rotations must start. And another question, say I hear a minister talking about circulars issued. I don't have access to a computer while at home. Where can I access information on circulars? And there's another question from Jason from Private Citizen, who is a private citizen. They say, can we please have a clarity on the redirection of PPE from education to health in the Northern Cape and Eastern Cape? And we also have another question from Silusa Ponyanda from Vukuzenzele. The question is, which departments and services will still not be open under level 4? And another question is, how do members of the public know what services are available so they don't travel to closed offices? Thanks.
Okay,
We have one caller
Okay.
on the line.
Okay.
You can go through.
Good morning, Mr. Minister. You're speaking to Tabi here, Northern Cape Town. Just a question for you. There are a few graduate interns that are becoming increasingly dismayed because of the lack of working experience that are able to accumulate as a result of their absence from work. What is the department's plan to try to ensure that the graduate interns are still able to continue with the program post-COVID-19?
Okay. Thank you, Minister.
DG will take the question from the last question from the caller from the Northern Cape. So stay alert. The first question, as I got it, is the determination of the number of workers. What are the estimates?
Yeah, a percentage. What percentage of the public servants' workforce were actually reporting for duty, that essential service you referred to, under lockdown 5?
Okay.
What is it at lockdown 4, 3, 2, and 1, for example?
Okay.
So we get an idea of the numbers of what you anticipate the growth in.
Well, I don't know whether DG will be able to assist me on that, but from where I sit, all I know is we issued a directive that say in each and every department, DGs and HODs must determine the number of essential workers. In other words, decide what constitute essential workers in your setup, and then accordingly make a determination of the number of employees required to render those essential services so determined. But I haven't counted how that has translated into actual figures per department and overall. If you can help, DG, that would be appreciated. And number two, did you talk about the incentive? No. Okay. Let me go on to answer this other question. What, when do we recognize community health workers? That's a question that was asked. We are in a process of working in particular with COCTA in relation to one category of community workers. I don't know whether this applies to health workers, community health workers as well. But what we're working towards with COCTA is that COCTA will take over community workers, and they will then finalize plans of recognizing such workers as and when those transfers happen. But generally, it's possible. I'm not saying that's exactly what's going to happen. That as we implement PAMA, that is Public Service Management Act, such matters or such categories of workers may be looked at in terms of norms and standards. That is, their work conditions, what they get paid, and so on. And indeed, it's a matter that all of us are sympathetic to, recognizing the work that they are doing, which is recognized by communities who are recipients of such services. But as to the date, that I can't say. But PAMA does give us a platform to consider how and when such matters can be dealt with going forward, and we're working on it. The next question was rotation of human settlement. I'll ask DG to look at that going forward, unless DG can answer that right now, because it pertains to the Department of Human Settlement. That may require that DG talks to the DG in Human Settlement in relation to the question. Access to circulars, I would say where an employee doesn't have, as I've said before, you don't have a laptop, you don't have a computer at home, and you don't have any other means, which I'll start by saying, your HOD or all HODs, all supervisors, need to explore other possibilities of communication over and above those that are normal, like landline, like a laptop or a computer, especially in relation to what the caller is talking about, including WhatsApp, including any other ways like emails and so on. Where all of these are impossible, I would ask that each employee, government employee, make means to be in touch with your supervisor. There should be no employee, there should be no government employee, member or who is employed by the state, who should feel lost for weeks and not account to anyone and not get in touch with any one of your supervisors. I would say that's not permissible. That's what I'm saying. Also talks to the need to cover for us to develop norms and standards that will cover each and every worker. In fact, I would say a supervisor who is not in touch with those that he supervises or she supervises for a week, there is an element of irresponsibility there. You can't just, as a supervisor, for the whole week say, no, people are at home, are working from home. The following week, people are working from home without getting in touch with them without knowing whether they are rendering any service in whatever way. So it's a mutual exercise. Let's have conscience, all those employees who are working from home, that there needs to be some activity, some contact with your supervisor in relation to this particular period in which we are. PPEs in Northern Cape and Eastern Cape. This particular matter, as we deal with it in council, is explained by Department of Health in the following manner: that in a particular hospital, as an example, there would always be PPEs, but the issue is for which ward, for which operation within a hospital, because in some circumstances, PPEs that work in a particular section are not the same as other PPEs that work in a different section. And in other words, you need particular PPEs that cover work in a particular section of a hospital. And therefore, one or two of those in each circumstance may be in shortage or in short supply. And it is in these circumstances that we're saying those stakeholders that are there, that work there, need to raise their hands all the time to alert the Department of Health so that they are able to act on that matter. But it has been demonstrated that Department of Health is making all efforts to make sure that PPEs are available. But at the same time, that there are gaps at different periods as a result of what I'm explaining. And therefore make a call, make an alert to your supervisor and to authorities of the department in specific circumstances in this relation. Level 4, which departments, how do we get to know which department is operational at which level? I would say, as a first thing, citizens must make an assumption, must work on an assumption that all government services are rendered. In other words, if you are in need of any government service, your first assumption as a citizen should say, let me get in contact with government and check how I can get access to this particular service. Then you will then get guidance. And if there is a problem of communication, your counselor or a telephone call or a WhatsApp, or in circumstances like this where we are in media and you are able to call. For instance, you could have included, or the caller could have included, if you're asking on your behalf, a question that say, I'm in need of this and this, we could have facilitated that. So whenever it is possible to make contact with any government official or any government employee, you take that to full advantage, and so that we resolve whatever problem of the time occurs. Thank you, DG.
Thank you, Minister. Good morning, colleagues. The question around the data, my response to the question is that we are still receiving reports from departments in terms of the workers in level 5 who have been working, so we are still receiving and consolidating those. Unfortunately, I don't have specific figures to give to you at the moment. In terms of level 4, preparedness of departments as well, we have presented to our colleagues who are DGs of departments and heads of departments nationally and provincially. We have presented to them the circular last week, I think on Saturday, and they have been given a period to go back to their departments and prepare the departments to be able to be prepared to take in the further measures that have been introduced through Circular 18, and furthermore to be able to allow more workers to come to work as per the needs and the demands in terms of the essential and critical services. In terms of there was a question about about employees of children. The approach really is that employees who have personal circumstances, discuss your personal circumstances. If you are in the list of employees who must come into the office physically to do some work, the circular, we have also advised DGs that employees can rotate. Like there are certain programs like Program 1, which has to do with administration in departments, business continuity, payment of service providers, HR support work that needs to be done, etc. Employees, to keep the numbers low in the workplace, employees can rotate. The cleaners, because there's not many people in the workplace, they can rotate. So you don't have to have the same cleaners coming every day, but 1 week or one day, one group will come, the following week, one group will come for rotation purposes. But those who have personal circumstances beyond are welcome to engage with their supervisors and with their heads of departments. And colleagues must also remember that some of them have leave that they are carrying, and if you have personal circumstances that would have required you to be at home, you still welcome to look at your leave and consider applying for leave where possible to be able to deal with your personal circumstances. But it's an issue that must be discussed with the head of the department. There was a question about rotation of employees, Minister, from the Human Settlements. I've just spoken about the issue. So the department, it seems, might have taken a decision to rotate employees. We're doing the same at DPSA in relation to our Program 1 employees. We're rotating them week in, week out, those who have to come to the office and be physically there. And they've been given the 11th of May. I would assume that the department has done all its preparedness, and by that day, they are aware that they will be ready to receive employees in the workplace. There's nothing untoward about that, but I will further take up the matter with the DG. What we are expecting today, Minister, from the DGs is also to confirm with us their plans. After we presented to them the circular, they are meant to come back to us and confirm their plans, which employees are coming, are expected to come back during level 4, and how many of those employees are expected to come back. And by when will those employees come back? And what is the system of remote work that is put in place? There was an issue around somebody who doesn't have information, access to a computer. We post our circulars on website, so if you have a phone, you should still be able to access that information. We also post on social media for easier accessibility, but as the Minister is saying, there has to be supervisors, there has to be an ongoing interaction between employees who are on remote work with the supervisors, and also from a health and wellness point of view, it's very important. So you can't just as a supervisor stay in the office if you're in the office or at home and not check on your people, because we know the mental health effects of this period that we're in currently to some of the employees. So we need, as part of that caring environment that we create in the workplace, to be able to contact employees. But also employees have a responsibility to raise a hand and contact the health and wellness system of the department, as well as engage with their supervisors when they have challenges that require attention. The graduate internship, or there was a question about the graduate internship. Minister, the graduate internship and the recruitment process are some of the work that we are doing currently, and we'll be communicating soon and give guidance in terms of level 4, what should happen in relation to this. You would recall that in level 5, we stopped the government circular, so we kind of stopped recruitment in the sense of advertising, because the vacancy circular, we've stopped it. However, departments that had already gone through the advertising process, some of them had gone through the recruitment process of interviewing, using virtual platforms to be able to interview and make appointments. I've seen that in the cabinet system. There's lots of appointments for DGs and DDGs that we have pushed through the cabinet system, because some of the interviews have had to be done virtually, and some provinces have gone ahead to appoint provincial heads during this particular process. So we will communicate effectively around that space. The DGs during our meeting at Net Joints had requested that we need to relook the issue of the vacancy circular. We need to relook the issue of recruitment, especially for critical service, for critical vacant positions within the public service. So we will be communicating in relation to that. The issue of graduate interns, we will also be communicating. I don't want to share my ideas at this stage, but there's some discussions that we are taking in the department about how we manage that, because it is a fact that they are losing time in terms of the exposure and the experience that they should be getting in the public service. Thank you, Minister.
Well, thank you, DG. We are now moving towards closure, but maybe before that, Minister, I'm getting some messages even on social networks, DG. Some people are concerned that we are not wearing our masks. So I think we need to clarify that one. There has been a special request from media houses that we lower our masks so that the broadcast quality is not compromised. But also there are people who are doing sign language interpretation. They also need to read our lips so that the message we are communicating is loud and clear to the public out there. But also are taking precautions. There are people who ensure that after each and every speaker, they sanitize the environment that we are using. So I think we are not trying to undermine government message. We are really committed to the fight against the scourge. Now we are moving towards closure. I don't think we have any questions, but also, how many do you have? The minister really has to go. Okay, can you take two, Minister? Okay, two questions.
No, thanks, Vukani. We have a question from Sapokas Ntika from Vukani FM. The question is, what about the departments that will be forcing workers to go back to work even if it is not safe to do so?
Okay. Let's take another one.
No, that was it. That was the final question. Thanks.
I take it that the question says, will it happen? Will government call you back to work even if it is not safe to do so? The answer is no. It won't happen. That is why we've taken the trouble of determining the needs of each phase. And we are saying, even through circulars and here, that even when it is time for a certain number of people to go back to work or to the workplace as a result of imperatives of a particular department, there are precautions that will be taken to make sure that the safety of employees is guaranteed. We have outlined them, and they're outlined in the circular. And if there is lack of clarity on the matter still, let's be questioned on that, and we'll provide. But from where we stand, we have made all efforts to make sure we guide each and every DG and each and every HOD to that effect, and we're working with organized labor in each department just to make sure that each place of work, as and when it will be time for workers to come back, is seen to be clean. And we'll make sure, in case you are called upon to come back and you are in doubt, please call us. We will be a call away. Thank you.
Once again, thank you very much, Minister, DG, and Special Advisor, for your time. And also thank you, members of the media. And also thank you, members of the public, for watching and participating. We are now adjourning the press briefing. Thank you very much.